disease is a bacterial infection that destroys the bone around the teeth, the supporting structure around the teeth. There's a chronic inflammation. The chronic inflammation is caused by these bacteria. The teeth lose their support and gradually become loose, often painlessly, until it reaches such a point that the teeth become so loose that they finally become uncomfortable or painful and have to be removed. Often there are signs, but often there aren't. Typically, one would say bleeding gums, shifting teeth, bad breath, swollen gums. Very often there are no signs. You never hear people tell you that, but very often there are no obvious signs. The only way to really tell in many cases is by radiographs, that's x-rays, or taking a measuring tool and measuring how much bone loss there is. Because I've seen many patients who really, their gums don't bleed, their teeth aren't shifting, their mouth looks healthy. I have many cases like that, but they've lost half the bone around their teeth or more. And when I take a sample of the bacteria, they're highly infected. There are two main reasons. First of all, and I'm not sure which is really more important. If you don't get your gum disease treated, you're likely to start losing teeth. But I think, and even more importantly, the link between gum disease now and systemic disease is growing. They're now finding 70%, you have a 70% increased risk of Alzheimer's disease if you have chronic periodontal disease. In men, you have a 59% increased risk of pancreatic cancer if you have periodontal disease. You have a significantly increased risk of all cardiovascular diseases, heart attack, stroke, diabetes, various cancers. I mean, I'm at least as concerned, and these days perhaps more concerned about the systemic health effects of periodontal disease, because it's not just a disease in your mouth, it's an infection in your mouth that affects your whole body, causes an inflammatory response throughout your whole body, which affects almost every part of your body in a negative way.